Oregon Health Authority, Dr. Dean Seidlinger, OHA's State Health Officer, and Holden Leung, Chief Executive Officer of the Asian Health and Service Center. I wanted to start out this morning by addressing the violent attack in Georgia this week and the rise in racist hate crimes across Asian communities. These hate crimes are absolutely unacceptable. They must stop. I know there's a lot of pain right now in our Asian communities and across our communities of color. I see that pain. I share your concern, anger, and disappointment that such hatred can exist. I grieve with you, and I will say this. I stand with you and will do everything I can to build a more equitable and just Oregon. Just this morning, the CDC issued updated guidance for physical distancing in schools. Throughout the pandemic, it has been our intent to align with CDC recommendations while taking COVID-19 conditions in our state into account. The Oregon Department of Education and the Oregon Health Authority are reviewing the new guidance, including the recommendation that 3 feet of spacing is sufficient when community transmission of COVID-19 is low. This is welcome news for many school districts. After ODE and OHA update their guidance, school districts will still need to have conversations at the local level to update their plans for a return to in-person instruction and go through their own decision-making processes. But I do hope this helps get even more of our kids back into the classrooms. Last week, we received welcome news from the Biden-Harris administration that all Americans will be eligible for a COVID-19 vaccine starting May 1st. It's truly remarkable that in just 1 year of this pandemic, we now have 3 safe and effective vaccines. Incredible and brilliant work by so many scientists, researchers, and medical experts to make this happen. And amazing work by the White House for working so hard to secure vaccine supplies and production agreements so early into this global vaccination campaign. Upon learning of the news, I directed the Oregon Health Authority to review Oregon's vaccination timelines. Equity has been at the forefront of our COVID-19 response and vaccine distribution. As we open up eligibility to all Oregonians on May 1st, I remain committed to the equitable distribution of vaccines for seniors, frontline workers, and Oregonians with underlying health conditions. My team is in touch with the White House for more specifics about when vaccine shipments to states will increase. We have always attempted to align our vaccination timelines with available federal supplies. And so far, it's been really encouraging to see so many Oregonians eager to get the vaccine when it's their turn. Provided supplies are there from the federal government, we will be accelerating our vaccine timelines as such. Starting this Monday, March 22nd, we will begin vaccinations for migrant seasonal farm workers who are currently out in the fields working. We will also accelerate the timelines for counties that can attest in writing to OHA that they have largely completed vaccinations for their currently eligible populations and are ready to vaccinate adults 45 years and older with underlying health conditions. As previously outlined, on March 29th, we will open up statewide to all adults 45 years and older with underlying health conditions. March was dedicated to vaccinating seniors, and we wanted to stay true to that promise. Director Allen will provide a progress update on that front. And then, no later than April 19th, we will begin vaccinations for frontline workers. And then on May 1st, we will open up to every single Oregonian, adults, of course. Just to be very clear, this doesn't mean every Oregonian will be able to get a shot right away. but every adult Oregonian will be eligible. We look forward to starting vaccinations for Oregonians with underlying health conditions. Not only will this next phase reach vulnerable people, but it also prioritizes equity, as communities of color are more likely to have several of these health conditions, such as diabetes or sickle cell disease. Moving forward, we will continue to center equity in all of our vaccine distribution efforts. So in addition to accelerating vaccination opportunities for our prioritized populations, we will also work with our local health partners after May 1st to ensure these priority groups continue to have access to appointments. The Oregon Health Authority tells me that provided supplies come in from the federal government as anticipated, we expect to have enough doses for every Oregonian who wants a vaccine to have the opportunity for at least a first dose by the end of May. That certainly makes me smile, and I hope it does you too. The future's looking brighter every single day. And as our vaccination efforts speed up, I want to thank Oregonians once again for making smart choices throughout the pandemic. Oregon continues to hold one of the lowest infection and mortality rates in the entire country. We have the 4th lowest infection rate since the start of the pandemic and the 5th lowest mortality rate. Your actions have saved lives. Thank you. And with that, I'll turn it over to Director Allen.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority. I'm joined today by Dr. Dean Seidlinger, our State Health Officer. This morning, I want to update you on where we are in the course of our COVID-19 vaccination effort and share a snapshot of senior vaccination rates across Oregon counties. I also want to tell you how many doses we need the federal government to send to Oregon so we can deliver on our goal to open vaccinations to all Oregonians by May 1st and vaccinate enough Oregonians to return to a more normal life by early summer. And finally, I want to tell you how our projected dose allocations line up with the next waves of people who will become eligible, when we forecast potential traffic jams, and when we think we'll reach the point where all Oregonians will have had an opportunity to get vaccinated. Let's go ahead and bring up the first slide, please. Let me just give you a quick check on the numbers. As of today, total doses administered in Oregon are 938,900. That have received at least one vaccination. By early next week, we expect to cross the threshold of 1 million Oregonians vaccinated. That's just less than 1 in 3 adults in the state. That figure represents a major milestone toward ending the pandemic in Oregon. We need somewhere between 7 to 8 out of 10 Oregonians to get vaccinated to achieve critical mass and shut down the virus so it can't spread and put more lives and livelihoods at risk. We're making progress fast. Overall, that number represents just under 1 in 4 Oregonians, including children who aren't yet eligible for the vaccine. Oregon has completed full 2-dose vaccinations or single-dose Johnson & Johnson vaccines for more than 500,000 people. Overall, 12% of Oregonians have been fully vaccinated. We're at the national average for fully vaccinated people. Let's go to the next chart, please. And let's go to the slide after that, please. Now let's look at where we stand in vaccinating seniors. On the eve of opening eligibility to people with underlying health conditions and other groups, as of yesterday, approximately 58% of all Oregon seniors have been vaccinated. That includes 65% of people 80 and above, 64% of people between 75 and 80, 59% of people 70 to 74, and 48% of people 65 to 69 years old. How long will it take for us to finish vaccinating seniors? Next slide. As this slide shows, Oregon is on a trajectory to vaccinate more than 7 out of 10 seniors by March 29th. In March, the vast majority of vaccinations have been focused on seniors. Oregon has been vaccinating seniors at a high rate this month. We're seeing a day-over-day increase of 1 to 2 percentage points, which we believe we can sustain as long as we have demand. Earlier this week, we were part of a 4-state outage in the alert immunization information system that disrupted data collection. However, Our numbers rebounded yesterday, and we don't think the outage will have any meaningful impact on our progress. Next slide, please. Now let's talk about why we think some counties can move forward and begin vaccinating older people with underlying conditions and other groups as early as next week. Next week, we'll offer counties an opportunity to attest that they're ready to open vaccinations to phase 1B group 6. As the map on the left shows, we have some counties that are well ahead of the state average in vaccinating seniors. For example, Deschutes County has already vaccinated more than 7 in 10 seniors. Benton, Baker, Polk, and Wheeler counties are close to that level. In the Tri-County area, 60% of people 65 and older have been vaccinated. Multnomah County has vaccinated 2 in 3 seniors. Washington County has vaccinated 6 in 10 older adults as of yesterday. As the map on the right shows, we have some counties that may have lower rates of vaccination, but also have fewer numbers left to vaccinate. They can reach out to those individuals to make sure they have a slot. But we don't want appointment slots left unfilled next week. If a county is closing in on a critical mass of seniors who've been vaccinated, or they have relatively small numbers of people left, the attestation letters will give counties the opportunity to begin vaccinating the next population and a chance to make sure those appointments get filled. Let's go to the next slide. That said, we're seeing the pace of vaccinations slowing in some counties. As this map shows, the rate of increase in the proportion of the senior population vaccinated was higher than 10% in 12 counties in mid-March, but that rate slowed to 5% or less in more counties. That's not because they're getting fewer proportional doses. We allocate doses to counties more or less on a per capita basis according to their senior population, and we've supplemented some counties with additional doses when they start to fall behind. Instead, we may be seeing some cooling of demand as we get deeper into the senior population in some parts of the state. We're going to keep a close eye on the situation as we move forward. So what does our long-term allocation forecast look like? Next slide, please. Will we have the vaccines to administer to the more than 2 million adults who will become eligible to be vaccinated in the next 2 months? The answer is yes, if the federal government comes through at the levels of vaccines we've projected based on the national numbers the administration has released. As we've seen before, we know there will be temporary traffic jams as demand exceeds supply. We know it'll take a couple of weeks to get through the surge, but we can keep pace. If we receive approximately 250,000 or more first doses per week from the federal government starting in early April and continuing at that rate through the spring. If we receive approximately 250,000 or more prime doses per week, we expect to have enough doses to begin to make vaccinations available to every adult Oregonian by May 1st. However, I want to be crystal clear. Not every Oregonian will have a vaccination appointment waiting for them. It'll take a few weeks for supply to catch up to demand. By the end of May, we'll have received enough vaccine to give all adult Oregonians at least their first immunization. Here's the math. As this slide, group 6, as this slide shows, when people over 45 with underlying conditions, pregnant women, migrant and seasonal farm workers, people displaced by wildfire and other groups become eligible statewide on March 29th, the total number of eligible people will exceed 2 million. Oregon will have received about 1.4 million prime doses. We'll have administered at least first doses to close to 1.2 million people. However, we will have the vaccines and the capacity to administer between 1.7 and 1.9 million first doses by April 19th, which is more than 3/4 of the eligible population at that time. Moving on to group 7, when Oregon opens eligibility to frontline workers, people younger than 45 who have underlying health conditions, and people living in multi-generational households on April 19th, the total number of eligible people will exceed 2.8 million. Once again, we'll play catch up for a couple of weeks. Not everyone who's eligible will be able to get a vaccine when they want one. However, by May 1st, we expect to have received approximately 2.5 million doses. That means we'll have received enough supply to vaccinate almost 9 in 10 people who would be eligible at that time. Finally, on May 1st, we'll open eligibility to all Oregonians regardless of age, occupation, or health condition. The total number of eligible people will exceed 3.2 million. As in April, there will be a traffic jam. Again, not everyone will be able to get vaccinated right away. But if the doses come through, we'll get through it. By the end of May, We expect to have received approximately 3.3 million first doses, enough vaccine to give every adult Oregonian at least one shot. Next slide, please. I want to take a moment and remember what a remarkable event this is in the course of the COVID-19 pandemic. Just over a year after Oregon recorded its first COVID-19 case, it's possible every Oregonian could get vaccinated against the virus that has claimed the lives of more than 500,000 Americans. Even until recently, in these news conferences, we've talked about our limited vaccine supplies and the prospect that it could take until late fall before we reach community immunity. Now it's possible every adult in Oregon could be vaccinated within 10 weeks. That's an extraordinary turnaround, but every Oregonian needs to continue to do his or her part and get vaccinated. We can starve the virus of new people to infect. When enough people get a vaccine, we'll be able to see our loved ones celebrate holidays and return to more of our normal life. I want to encourage every Oregonian to go to our updated covidvaccine.oregon.gov website, sign up for notifications in the Get Vaccinated Oregon tool, and make your plan to get vaccinated. Now I'd like to turn it back to Governor Brown.
Thank you, Director Allen. Next, I'm pleased to welcome Holden Leong. He is the Chief Executive Officer of the Asian Health and Services Center. So delighted to have you join us this morning. Thank you.
Good morning. Once again, this is Holden from the Asian Health and Service Center. I'm excited to join this press conference, learning that more supplies will be coming to the state, and also we've been working with the Tri-County public health divisions to help to engage with the community. If I may use a metaphor to show how we can reduce the traffic jam, is I see that supplies is somewhat from the warehouse that being shifted to the state, and then state have the structure somewhat like the big truck that can haul into different counties. But once it entered to the different county, it may cause traffic jams that to how to access those megas vaccine sites, including the convention center or the airports. So the Asian Health and Service Center have the opportunity to partner with Multnomah counties and also one of the FQHCs, the Rosewood Family Health Center, in late February. So because during the pandemic, the Asian Health and Service Center developed the COVID-19 Asian Response Team, somewhat like the short form is a COT. So I use that metaphor to say that we are a very flexible and movable COT. We can connect with the big truck and then bring the supply, bring the vaccine to where people's most needed. So our role is more as a community partner in the community. So using our experience in late February together with Rosewood Clinic, and which is a branch of the Yakima Valley Farm Worker Clinic, FQHC, and also together with Multnomah County. And also we are able to invite more than 60 medical students from Oregon Health and Science Service Center. So in 2 days, we serve over 1,000 people. So it's very efficient and effective. One thing that I have to keep credit to my staff is in the last entire years, we keep connecting with our people. We connected over 8,000 people. And among those people, we screen out about 3,000 people are over 65, knowing that the supply may not be able to meet the demands. So we, on one hand, work closely with the system, but at the same time, to help to screen out that among that 3,000 members, we screen out about 1,000 members into to the pilot projects. That makes who are eligible, people who are over 65, people who are living with chronic disease like mental health issue, cancer patients, and also their family caregiver. So we successfully launched our project in our Lance neighborhood on Foster Road, where we have the highest concentration of Asians. So we would like to share that experience that, well, if we can partner with the system, we can help to like reduce the traffic jam. At the same time, as Governor mentioned at the beginning, is that, well, on top of the pandemic, lately there's hate crimes against Asians. So making my constituents, my community, afraid to go to those public area or like hillsides to receive vaccines. So with that said, I hope the system will consider like CBOs like us can be a partner to reduce the traffic jams. At the same time, if patient can engage earlier, that will reduce their resistance to like get the vaccine. Not to mention that because of the language, the cultural challenge, I think providing a culturally comfortable setting can accelerate to like reach those people using our equity lens. I think that is something that I appreciate what the system have been supported and the CBOs in town. But at the same time, I really want to like thanks like Director Allen from we have contract with the OHA, but at the same time, I think in view of the coming months, we may need to accelerate that like approach to like reach more than just the Asian community. Thank you.
Thank you so much, Chief Executive Officer Leung. Thanks to you and your team and your great work you're doing in our communities around the state. With that, Charles, we're ready to take any questions.
Thank you, Governor. Just a quick reminder for the reporters on the line, please use the raise your hand function to ask a question. We'll start with Rachel Alexander with the Salem Reporter. Go ahead, Rachel.
Hi, thank you. I'm wondering what guidelines OHA will use to determine if counties are able to move up in the vaccination timeline. I understand both Marion and Polk County commissioners have requested to do so. Is there a target for the percentage of seniors they need to have vaccinated, or is simply a testing that they want to move forward enough?
Thanks, Rachel. I'm going to turn that question over to Director Allen.
Yeah, it'll be simple attestation. And the reason for that is it's difficult to set a set percentage as a target, given that the percentage of seniors who want to get a vaccine is highly variable across different counties. And so we think that county commissioners and in consultation with their public health departments are in the best position to assess things like are appointments filling up quickly or not, or have they reached hard to reach populations? And so we'll simply take that attestation.
Thank you, Rachel. We'll go next to Bill Poehler with the Statesman Journal. Go ahead, Bill.
Yeah, hi. So Governor Brown, in January, in prioritizing teachers to get vaccines over seniors 65 and older and those with pre-existing conditions, you cited suicides among youth, and particularly you pointed in an example of 11 and 12-year-olds. According to preliminary data from Oregon Health Authority, suicides in Oregon were down in 2020 from 2019 by 10% to 818 from 908 in 2019, and their preliminary information indicates the youth suicide rate decreased again in 2020, and hospitalizations, suicide-related visits to emergency rooms and urgent care centers for those ages 18 and under declined in 2020 from 2019, especially in months that schools were closed for in-person instruction. So how do you reconcile that with the data, or your decision with the data from Oregon Health Authority?
Thanks, Bill. I appreciate the question. I obviously don't have my words right in front of me, but my recollection is that I was referring to suicide attempts. And I will tell you, both in terms of conversations that I've had with superintendents, with educators and parents, there's absolutely no question that our children are suffering from the pandemic and not being in-person learning, whether it's an increase in suicide attempts, whether it's depression, whether it's anxiety. We know that our children are really challenged with comprehensive distance learning. And that's why I wanted to move forward on vaccinating our educator workforce so that we could get our students back into the classrooms as quickly as possible. As you know, it took a number of tools, including increasing testing, increasing resources, and making sure that we had the safest protocol that we could provide for our school districts across the state. The good news is that we have close to 200,000 students now in some type of in-person learning, whether it's hybrid or in-person, and more to come over the next couple of weeks. We are still going to need to provide extra supports for our kids that have been without the in-person learning, the social and emotional supports, the peer interactions, and frankly, for some, just the meals and a safe four walls that a classroom can provide. That's why legislative leaders and I stepped up to create a summer program package, investing over $250 million, I think a total of $325 million with federal resources to support our children with enrichment, academic and other during the summer, so that they can have access to social and emotional supports. They can have access to creative and innovative classroom learning, that they can have an opportunity to play. So we're going to continue to focus on making sure our students throughout Oregon have the supports they need. Every one of our students has the supports they need to thrive.
Thank you, Bill. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
Yeah, hi. Thank you for having this meeting today. I got a couple of questions that are all related. The attestation from the counties, do the counties already know about this, and have they sent in attestations? It's Friday. Are they going to be able to get some sort of response so they can be ready on Monday? That would be number one. Number two, Pat, you talked about the amount of vaccine that's needed. You're getting about what, 200,000 doses per week. Do you know what you're getting just for like next week? And is there any ramping up? And the final part was, you mentioned 3.2 million people who are eligible for the shots. I've seen the figure of 2.8 million adults, which may be 18 and over in Oregon, but if you could tell me where that 3.2 million came from. Thank you.
Yeah, so in reverse order, 3.2 million is our Portland State's estimate of how many adults there are in the state. So it may just be a question of when that number came from. 2.8 million sounds like it might be the previous census, so
Okay.
it would be a little bit old. We
Pat,
do not
just
see
real
an
quick.
increase in our. Go ahead.
Just real quick on that. When you say adults, you mean 18 and over?
Correct.
Okay.
Although people 16 and older will be eligible, but there's not data that cuts that number quite as specifically, and they'll be eligible for just one of the vaccines as we sit today. The answer to your second question is no, we do not see an increase in doses starting next week at this time. It's possible that could change, but we're keeping an eye on that closely. And the answer to your first question is I've already received letters from counties attesting that they are ready to move forward. We have provided guidance to them, and the process is that they will not need to receive a response from us. It's an attestation and go forward. Since there's not a threshold or an assessment or anything like that, once they've attested, they can move forward.
Thank you very much.
Mm-hmm.
Thank you, Gary. We'll go next to Lindsay Nadrick with COIN. Go ahead, Lindsay.
Hey, I was wondering, could you say what counties have attested to move forward already? And then I have another question. I talked to frontline workers yesterday who feel like they have been left behind. Washington is already starting to vaccinate frontline workers. It looks like they're not going to be eligible until April 19th. That's only 2 weeks before the general public is eligible. Why was that decision made? They just feel like they're not being prioritized, and they're the ones who have had to work through this, can't work from home, and have to interact with the public.
Lindsay, I'll take the frontline worker question and pass the remainder over to Director Allen. In terms of frontline workers, I want to say thank you. You literally have been on the front line since the beginning of the pandemic, making sure that our society could function, that we could show up at a grocery store and purchase the groceries we need to fix dinner and lunch and breakfast. You have been providing public transportation for folks to get to appointments and to get to work throughout this entire pandemic. Oregon sees you and hears you, and we are incredibly grateful for your work. You will be in line to receive vaccinations April 19th. And as I said in my opening remarks, we will continue to prioritize frontline workers and other vulnerable populations. Obviously, our ability to vaccinate is dependent upon the vaccinations we receive from the federal government. And we're working with our local partners, community-based organizations, employers, and local public health to make sure that we can get our frontline workers vaccinated as effectively and as equitably as we can. In terms of the next question, I'm going to turn it over to Director Allen.
Yeah, and you caught me a little off guard. I believe I received 2 or 3 letters yesterday. I recall that Marion County was one of them. I don't recall the others, but we can get back to you.
And if I could ask a follow-up to the governor, frontline workers, that's one of the things they were a little frustrated about, is that they've been thanked this whole time, but then weren't given any kind of priority. Is there going to be any priority when this opens to the general public that says a frontline worker can get a vaccine before someone who, you know, can work from home at all? Is there any way to do that when people are booking appointments?
So let me be very, very clear. We have continued to prioritize equity in our vaccine distribution efforts and are focused on addressing the needs of our most vulnerable populations. We have used the work of the Vaccine Advisory Committee in determining our priority populations, and I really appreciate their efforts and their time and energy in helping us focus these efforts. In terms of moving forward post May 1st, we will continue to prioritize and make sure that frontline workers and other vulnerable populations will continue to receive access to vaccines. We know it's going to be a lot of people coming online in a very short period of time, but we're very committed to continuing to work with our community partners to get this done and get it done right. I will say, in terms of frontline workers, I really appreciate employers stepping up to coordinate and partner with us to make sure we can get their employees vaccinated both effectively and efficiently and fairly.
Governor, could I add to that a little bit?
Sure, please, please.
I think first that when the administration announced that they were going to require us to make all populations eligible on May 1st, that did put us in a bit of a bind, given that that was the date that frontline workers and younger people with underlying conditions were going to go forward. So I think we've preserved prioritizing frontline workers by moving that date up to May 19th. And as I indicated, before May 1st, we will have received enough doses to be able to vaccinate 80 or 90% of that population. And so I think we've got the ability to, in fact, continue to prioritize them ahead of the general public. And as the governor indicated, we've got the ability going forward to work with employers, particularly if there are populations that haven't gotten vaccinated in that window, to be able to continue to do that. Employers and unions.
Thank you, Lindsay. We'll go next to Genevieve Riom with K2. Go ahead, Genevieve.
Thanks for taking my question. Sorry for the delay there. I have a few questions here. I want to start with one for my colleague asking specifically, and this can go to Director Allen. You mentioned bottlenecks in the scheduling process ahead. What steps is the health authority taking to prepare for widespread eligibility of the vaccines, and will you be increasing personnel?
Yeah, a lot of the steps that we've taken to deal with seniors are the steps that are now in place that will help with those bottlenecks going forward. Those bottlenecks should generally be smaller than the senior bottleneck was, given that by the time we made those 65 and older eligible, that was about 750,000 people. in the face of about half the amount of vaccine that we're getting. So the eligibility categories should be less significant than that, and or on par with that, but with much more vaccine in the pipeline. So we've already expanded staffing, for instance, at the 211 call center. We've shifted the convention center to basically a sign up, and we'll get invited to schedule an appointment system that'll help a lot. So I think what we've done so far to accommodate seniors will help address that.
And Director Allen, while I have you, I want to talk about the seniors and where they stand. You were mentioning that Multnomah County has only vaccinated 2 in 10 seniors, but for example, Deschutes County is doing 7 in 10 seniors. Is there going to be a specific, you look confused, am I getting the numbers wrong?
I think I said 60%, 6 in 10 in Multnomah County.
Okay, I must have misheard that. Okay, so 6 in 10 seniors in Multnomah County. Is there any specific effort at the end of this race to get seniors vaccinated to get them to the front of the priority line?
I don't think it'll so much be getting them to the front of the priority line. It'll be what's the focused outreach that we need to do to get to the seniors who want the vaccine. And so things that we're doing now in terms of outreach to individuals who are homebound, mobile vaccination clinics and efforts and those kinds of things. Each county is approaching that a little bit differently, but I think that's really what the work is going to be: is how do we get to people that we've not been able to get to so far.
And last week you mentioned that roughly 20%, you were doing 20,000 vaccines a day. Do you have a specific goal as to how many vaccines you need to be giving a day to get all Oregonians at least their first shot by the end of May?
Yeah, we're at 25,000 per day, and we would really like to double that based on the supply that we get.
Thank you.
Mm-hmm.
Thanks, Genevieve. We'll go next to Andrew Thien with the Oregonian. Go ahead, Andrew.
Thanks for taking my question. Quick clarification on the migrant and seasonal farm workers piece. So those workers are eligible starting Monday, correct?
That's correct.
And can you say which counties? Do you know which counties we're talking about and how many workers are eligible?
Andrew, I'm going to turn that over to Director Allen. Director Allen, can you respond to that question, please?
Yeah, what we're trying to do, broadly, agricultural workers become eligible on the 29th. What we're trying to do on the 27th is give local public health the flexibility to deal with migrant seasonal farm workers that are showing up in their counties right now. We think that's a relatively small number. We're working on a vaccination event, for instance, in Morrow County, I believe next week. And so this is basically trying to take advantage of the fact that people are arriving and they're there, and give local public health the flexibility that federally qualified health centers already have and are using to get to a population while it's particularly accessible. In the main, the larger number of agricultural workers will become eligible on the 29th.
Okay, and do you know how many counties other than Morrow we're talking about, Director Allen?
No, it would be the counties that typically have agricultural work. So, Willamette Valley counties, coastal counties, Morrow, Umatilla, Malheur counties, Hood River and Wasco counties as well.
Okay, thanks so much.
Thanks, Andrew. We'll go next to Brooke Jackson Glidden with Eater PDX. Go ahead, Brooke.
Hi there. Thanks for taking my question today. I think Andrew asked a big chunk of my question, which is generally how the breakdown works between migrant workers, which are eligible on the 22nd, correct? And then other agricultural workers would be the 29th. Is that right?
That's correct.
Okay, perfect. I also wanted to clarify in terms of the way the state is prioritizing equity. Perhaps I misunderstood the eligibility category for people 45 years and older with underlying conditions. That is ahead of the April 19th deadline, or is it at the same time?
Director Allen.
Yeah, underlying conditions of 45 and older is on the 29th, the date that it has been previously.
I see. So I was just wondering what the choice was there in terms of prioritizing people with underlying conditions that are over 45 ahead of frontline workers like grocery and restaurant workers. who, per my understanding of CDC recommendations, should have been prioritized ahead of those populations.
Yeah, so the thinking from the Vaccine Advisory Committee and our work in splitting the age groups was based on two things: risk of exposure and risk of bad outcomes if someone gets sick. And so when we agricultural workers are really the first category. Some of our worst outbreaks have been in food processing, migrant seasonal farm workers, other agricultural workers, and so we wanted to make sure that people who have one of the biggest risks of being exposed get vaccinated. People with underlying conditions definitely have a much more serious risk of hospitalization and death than other individuals do, and so that was the reason to prioritize them as well. And then both those groups tend to be overrepresent communities of color, which also are significantly at risk from the disease.
Thanks, Brooke. Our next question is from Pat Duras with KGW. Go ahead, Pat.
Yes, good morning. Director Allen, could you just help maybe clear up as far as the math? Could you tell us how many new people become eligible on March 29th? How many new people on April 19th? And then finally, what the remainder would be that become eligible on May 1st?
Pat, the answer to that actually is no. As we vaccinate more and more people, the issue of people showing up in more than one population becomes more and more difficult to manage for. We can do some sort of very high level estimates of where we think the accumulative total will be, but it's really difficult at a detailed level to try to give you a specific number on each of those dates.
And is that why when you were running through your presentation, you were talking about 3.1 million doses, et cetera? You're using those numbers, and that's from the very beginning of when the program began to roll out. Is that correct?
That's correct.
Okay, thank you.
Thanks, Pat. We have time for just a few more questions. We'll go next to Jamie Goldberg with the Oregonian. Go ahead, Jamie.
Thank you for taking my question. I wanted to follow up on the comments on frontline workers. We've seen in Washington, for example, them separating out certain high-risk frontline workers, which has included things like public transportation workers and grocery store workers. I wonder why Oregon hasn't decided to maybe separate some of those some of those frontline workers who are interacting very consistently with the public and giving them a chance to get vaccinated sooner. And then separately, I saw that the pharmacy increase, that there are more pharmacies now working with the federal pharmacy program that are vaccinating people in Oregon. And I just wondered at this point, how many vaccines are those pharmacies getting per week, and how many vaccinations are happening at pharmacies per week, if that number is available.
Director Allen, can you address the retail pharmacy allocation as well as the frontline worker question, please?
Sure. So with respect to the federal pharmacy program, I don't have those numbers off the top, but we can follow up and get you what the allocations are and how much vaccination is occurring there. In terms of frontline workers, our definition of frontline worker keys on workers who are not able to maintain physical distancing, either with coworkers or with customers or those kinds of things. And so they come in exposure eligible at the same time.
Thank you.
Thank you, Jamie. Our last question today is from Lincoln Graves with K2. Go ahead, Lincoln.
Thank you for taking my call. Governor, you mentioned you were pleased to hear about CDC guidelines involving 3 feet of distance in schools, while also acknowledging local conversations that need to happen in districts. Is this something where you think the state would get involved if some districts choose not to go with that 3 feet rule and instead stay with 6 feet?
That information, Lincoln, just came out this morning. And so the Department of Education and the Oregon Health Authority are reviewing the information from the CDC guidelines. We expect to take action quickly, and I'll let Dr. Dean Seidlinger fill in a bit more detail.
Thank you, Governor, and thank you, Lincoln, for that question. I think, we've been actively working, following the research on that shows limited transmission in schools, and that includes some additional studies that have come out in the recent weeks that shows that 3 feet of distance can lower the risk of transmission in schools, as well as 6 feet when it accompanies other guidance. We're pleased to see that the CDC released some additional data today and studies, as well as updating their guidance. So we've been in active communication, Oregon Health Authority and Oregon Department of Education, to see how we can align Ready School Safe Learners guidance with the new CDC guidance and try to get that those guidelines incorporated into Ready School Safe Learners as quickly as we can. So then schools will have that in place as they plan the rest of the school year and have conversations in their community. I think what this shows is that we can keep risk low in schools with 3 feet of distance in most conditions, with masking and the other strong safety measures that are in place in Ready School Safe Learners, and allow students, teachers, and the families they go home to have a low risk of transmission of COVID. Schools are one of the safest places that we can get students, that we can get teachers and other staff, and we need to do everything we can to try and return as many students and teachers into in-person instruction as quickly as we can.
And just to be clear, and correct me if I'm wrong about this, Dr. Seidlinger, the guidance for 3 feet is at the elementary level. Is that right?
The guidance for 3 feet focuses on students, and students in the elementary level should be able to sit 3 feet apart in their classrooms, but should maintain 6 feet of distance from those who are not in their cohort when they're moving about the school. For middle schools and high schools, the CDC also recommends that in communities with low transmission, defined by the CDC as under 100 per 100,000, that they can also have a 3 foot distance. For older students where cohorts are not maintained and there's higher rates of transmission, the CDC still does recommend a 6 foot distance. And we think that we can incorporate all of these nuances into the Ready School Safe Learners so that schools can operate with low risk for their students and staff as they return to school and participate in more in-person instruction throughout the rest of the spring.
Thanks, Dr. Dean Seidlinger and Director Allen. We're very excited about getting more kids back into the classroom as safely and as quickly as possible. Charles, are we out of time?
Yes, thank you, Governor.
Okay. I just want to close out this afternoon by saying thank you to our partners and community-based organizations like the Asian Health and Services Center. Very pleased that Holden Leung, the Chief Executive Officer, could join us this morning. Thank you all. Please continue to stay safe out there and take care.